Okay, great. Um, Thank you for joining today. Good morning, good afternoon, good evening, wherever you are in the world. This is a virtual brown bag with the UN Trust Fund to End Violence Against Women. And today we are going to be engaging with the findings of a recently completed meta-analysis and discuss what we can learn from project evaluations funded by the Trust Fund to End Violence Against Women and Girls. So thank you all for being here. Just really quickly want to give you a sense of our plan for today. I'm going to be inviting Gemma Wood to open up our session and share some remarks and background. And Gemma is the M&E and Knowledge Manager with the Trust Fund. And then we're going to move into the presentation. So we will have quite a lot of time to engage with the findings of the meta-analysis, and then a fair bit of time as well for question, answer, and discussion. So that really is just to kick us off. We see people are still joining, so we're happy to see that. Again, the session is recording, and we will share the recording when it is available in the follow-up to this webinar. So with that, Gemma. Gemma, you're on mute.
Thank you. Thanks, Danielle, and welcome to those who are joining. Hi, I'm Gemma Wood. I'm the Monitoring, Evaluation and Knowledge Manager at the UN Trust Fund to End Violence Against Women. And we're delighted to see so many people joining this presentation on the meta-analysis of project evaluations. So delighted to see some familiar names on the chat from many of the civil society organizations we fund. So that's fantastic. So as Danielle said, I'm just going to give some opening remarks and introduction, and then we'll leap straight into the findings. So next slide. So for those of you who don't know the Trust Fund, I just want to give you a little bit of an introduction, as we may have some new people to our sessions. So the United Nations Trust Fund to End Violence Against Women was created in 1996 by General Assembly resolution in recognition of the need for financing to end violence against women. So we've been going since then, and we have 24, now we're almost in 2020, end of 2020, so 25 years of grant giving coming up. And in that time, we've funded 572 projects until the end of 2019, which are worth over $174 million in grants, which is fantastic investment in ending violence. Not enough, but good. And in terms of how we work, we're an interagency mechanism. So we were originally born out of resolution, as I said, and we moved to the management of UN Women when it was created. But we have a global program advisory committee that includes representatives from UNICEF, UNDP, UNFPA, other UN experts, and other UN and other experts in general. So we have representatives from the non-governmental sector. So we really hopefully represent a cross-agency and cross-expertise perspective. And our projects are very demand-driven. So the initiatives we fund, they're born from proposals that are submitted mainly from civil society now, through an annual call for proposals. So every year we announce a call for proposals, and we receive 1,000 to 2,000 even applications every year. And through these advisory committees, we identify projects that look suitable for delivering results on ending violence against women. And we try to have an even spread of projects across the regions, as you can see here. So moving to the next slide. But I wanted to emphasize that our projects are demand driven. So we don't dictate what kind of proposals we're going to receive. We listen to the civil society who prepared the proposals. We assess them according to some criteria, but we don't get involved in project implementation. We do provide some training and capacity development and project management, but we are not there hands-on implementing the projects. These are very much owned by the civil society that we fund. In 2015, we launched a new strategic plan that will actually end in 2020. But for the period of 2015 to 2019 that this meta-analysis covers, we funded 179 projects worth over 71 million. And of that, the majority were civil society-led organizations, 60% women's organizations, and 94% women-led, which is a commitment that we have to fund women's organizations and women-led organizations as far as we can. The strategic plan had 3 focus areas: preventing violence against women, mainly through changing of norms, attitudes, and behaviors; improving access for survivors to multi-sectoral services; and implementation of laws, national action plans, and policies, and improving the effectiveness. So we welcome proposals in these 3 themes. So you will see in this meta-analysis that the range of projects cover all these 3 areas. We're very pleased to report that we, through our projects, have been able to reach over 22 million people, benefiting women and girls, and also the change agents, the men and boys involved. Next slide. So what about our evaluations? So we've had this long history of 500 projects and many, many initiatives across the world, globally, and over 70 countries. Well, we realized in 2010 that we need to properly evaluate this progress. So we introduced mandatory final evaluation for all projects we fund in 2010. This means that we started to receive evaluations in about 2013 to 2014. The UN Trust Fund does not get heavily involved in these evaluations, but we do specify that the grantees must budget for, plan, and manage a final external evaluation. And these must adhere to UN evaluation standards to a certain degree, though we're somewhat flexible given the context of these are not UN projects. We provide standardized evaluation questions on effectiveness, sustainability, and impact. And we do recommend that national consultants are hired. We have a strong commitment in the UN to supporting national capacities. So civil society hire, manage, and produce these evaluations predominantly with support from national experts. The UN Trust Fund does provide guidance, training, and quality assurance for the process. And in 2018, we realized that the evaluation practices were somewhat burdensome for smaller grantees who were receiving smaller amounts, under 150,000. So we decided to centralize that, and we now support smaller organizations to actually manage and co-manage the evaluation with them. And hopefully you may have attended a session last week or 2 weeks ago where we talked about one of these evaluations in Europe and Central Asia. So what's the aim of all of this? Well, evaluations aim to predominantly inform the project and the continuation of the project. And we're heavily committed to the utility of evaluations for the actual implementers, the service, the civil society organizations and their partners. But in addition to that, we, through these evaluations, want to extract important knowledge that can go back into the field of ending violence and really improve the knowledge base from the voice of civil society and the national consultants. And this can complement the evidence base that we have, which is predominantly research heavy. So the next slide. So it dawned on us that we have these hundreds of evaluations now. And in 2016, we started a process of doing periodic meta-analysis to have a look across these evaluations to see, well, what are the common lessons and common challenges? So we did one in 2016, which is on our website. And now as we come to the close of our strategic plan period, we commissioned another meta-analysis, which we'll talk about today. And so the purpose was to extract lessons on what works and what doesn't in the field of ending violence from just a subset. As you can imagine, we have hundreds of reports, but with a small budget and with limited resources, we had to choose a subset of 30. And Monica and Radhika, our consultants, will explain how we approached that selection. And through this, we want to contribute particularly the knowledge from civil society and from the national evaluators. We hope that the meta-analysis would delve deep and look beyond just the results, but actually the pathways towards effectiveness, sustainability, impact. What are the actual characteristics in project design that can help us understand really how to design, manage, and implement projects in ending violence? And of course, we want this to inform donors, including ourselves as a grant-making mechanism. This needs to inform our next strategy and how we design the way that we invest in civil society. So the next slide. So we're coming to the close of my introduction, and I wanted to really promote our evaluation library. As I mentioned, we've been ensuring that our projects are evaluated since 2010. We now have over 150 evaluations, and we're slowly putting these on our evaluation library. So this is the link. We have 83 up there. For those of you who are joining from those projects we've funded and civil society we've funded, you should see your evaluations there. We want to promote your learning. So you can go to this evaluation library, you can search by country, by topic, by region, and find this very useful learning from across the world. 83 now, we hope to put them all up there. It includes a summary and a short extract so that you don't have to read the whole report. And the final slide, I will be introducing the evaluation team. So we hired 2 external experts to help us. So the meta-analysis is independent and external, apart from areas that we co-created together. And we hired Monica and Radhika to help us. So Monica is CEO and founder of Qual Analytics. She has a PhD in sociology from Duke University and has held academic appointments at Yale, Duke, and American University. She studies the implementation of development projects globally with a sociological lens. She advocates for mixed methods evaluations, integrating rigorous qualitative methods with quantitative surveys. And her publications have appeared in Social Science and Medicine, World Development, American Sociological Review, Global Health, AIDS Care, and Journal of Epidemiology and Community Health. So thank you, Monica, for all your work with us. And Radhika is a researcher and development communication specialist. She is a consultant on development projects with a number of agencies and philanthropies, including the World Bank, GIZ, Societal Platform, and today Qual Analytics. She holds degrees in development studies, environmental policy, political science, and economics from the University of Strasbourg and the London School of Economics and Political Science. And she is based in India, and I think Monica's in DC. So we were so delighted to work with Monica and Radhika, and also their assistant evaluator, Lisa. So I will be passing over to them, but just to say, I will return at the end just to give some reflections on how we will be using this meta-analysis to inform the trust fund, and also a call to action to all of those online to say, how can you get involved and how you can work with us further on this extremely important body of evidence. We really have found through this that there is such a great contribution from the civil society organizations we fund on the knowledge from the projects that they're implementing day after day. And although we can't get into it today, we obviously are seeing the impact of COVID-19 heavily on the learning, and we want to now very quickly pivot in the next year to how to then put this in the context of this crisis situation of COVID and adaptations to flux and change. So thank you, and over to Monica and Radhika.
So thank you so much, Gemma, for that introduction. Thank you, Danielle. Thank you to Shruti and everybody in the UNTF team for guiding this meta-analysis. And thank you everybody for joining. It's really remarkable to see this interest in this analysis. And last but not least, thank you to all the CSOs who work so hard. I'm in awe of the work that you do. So just to give you an outline for this presentation, can we have the next slide, please? The next one. So I'm going to quickly touch upon the methodology. We can always return to this if there are any pending questions. I'm going to be brief so that I can spend more time on the findings. This will then be followed by research questions that guided the analysis. And then we'll get into the meat of the matter, which is the findings, which will be divided into the three areas that the UN Trust Fund emphasizes for the evaluators, that is effectiveness, impact, and sustainability. And for effectiveness specifically, we're going to be looking at an ecological model, looking at the individual level, community level, and structural level. And Radhika, when she talks about the research questions, will explain how we constructed this, the ecological model. We'll also talk about some of the challenges and the strategies to overcome challenges, and we will end with conclusions and recommendations. Next slide, please. So with the methodology, as Gemma mentioned, the first step was really to do a meta-evaluation. So from that meta-evaluation, which consisted of a total of 79 reports, we then identified 30 high-quality end-of-project evaluations. These were implemented and completed between 2015 and 2019. And the way that they were determined to be of high quality was using a UN Women-wide matrix called GERAS, which has 8 parameters. Of those 8 parameters, we specifically looked at 3, which is the methodology sections of these reports, the finding sections of these reports, and the overall score. So just collating across these 3 particular parameters, we identified a subset of 30 reports from the 79 reports. And it's important to point out here that these were really the quality of the end of project evaluation reports. These are not about whether the projects were successful or not successful, or implemented well or not implemented well. This is how the quality of the end of project evaluation report was. So just bearing that in mind. Next slide. So just to give you an idea of the spread, as Gemma mentioned, the UNTF literally works across the globe. And if you look at the table on the left, which is on the region, you see that a total, there's a fairly good spread across the regions, but Africa as a region had the most number of reports that went into the meta-analysis. So it says 9 out of 17, which basically means you had 17 reports in the total 79 that were from Africa, out of which 9 went into the meta-analysis. On the other end of the scale, you had 2 out of 9 reports from the Arab states and North Africa, but I would say there was a fairly decent spread across regions. In terms of cycle, which is the table on the right, each successive cycles had more reports that went into the meta-analysis, resulting in cycle 20, which had pretty much all of them, 8 out of 9, which attests to the fact that the quality of the reports got better as the cycles went along. So successive cycles, the reports got better. Next slide. So in terms of how we actually did the analysis, this was done in 4 stages. The first was to identify what are the entry points. The types of projects that the UNTF funds is quite varied, has a lot of breadth, not just in terms of geographic areas, not just in terms of the countries, but also in terms of settings, the people they work with, the types of issues that they want to address. So it's quite a wide array of projects. So really one of the crucial questions is, how do you then enter this whole data set? It has both opportunities, because it's an enormous data set, you can learn a lot, but it also has challenges, because then you have to figure out, okay, how do I make sense of this? How do I get my arms around it? And so in the next slide, when Radhika talks about the research questions, we'll identify the different research domains. Can we go back to the previous slide, Danielle? So after we figured out the entry points in the research domains, we created a database that had associated codes. We extracted the data at the end of the coding process and we analyzed. And we use contrasting examples, which will be clear when we go through the findings. And last but not least, and this was a very important step, we co-created the conclusions and recommendations. As external evaluators, we had to be very confident that the findings are coming from the data that is presented to us. But in terms of coming up with conclusions and recommendations, we really engaged with the UNTF because they know a lot more than we as external evaluators do. And again, this will be clear when we come to the conclusions and recommendations at the end. Next slide. I'm going to turn over to my colleague, Radhika, to talk about the research questions.
Thank you, Monica. So as Monica said, the research questions focused on three main domains of interest to the UN Trust Fund: the effectiveness of the project, the impact of the project, and its potential for sustainability. And under each domain, we used questions to examine the evidence on pathways to change that projects demonstrated, basically to understand and develop an understanding of the processes of change. So with the first domain, that is effectiveness, we applied an ecological framework, that is to say, a three-tiered framework to assess strategies for reducing violence at three levels, beginning with the individual and their relationships, and then to the community level, and then at the structural level, and I'll get to that in the next slide. Effectiveness was also mapped across three focus areas of intervention that the UN Trust Fund grantees work on. That is the prevention of violence, improving service delivery, and strengthening the institutional responses. And so within each of these categories, the questions were designed to understand the process of going from awareness to action. So what are the promising strategies to raise awareness and change with individual mindsets? And once awareness is raised, what are the promising strategies to improve individual action, for example? And then, of course, for each level, we also looked at the strategies to overcome challenges faced at every step. Next slide. With impact, the research questions on impact were looked at: to what extent has the project achieved its intended impact? So what's the evidence there, and what can we see? And then we also looked at the unintended impacts, both positive and negative unintended impacts of the project. With sustainability, it was fairly straightforward. The question was to understand the evidence on the sustainability of the intervention results and what are the different pathways that we see this evidence. Next slide. So a quick note on this ecological framework that we applied for effectiveness. We essentially considered the evidence at three levels: individual, community, and structural. Individual, for example, looked at the project strategies that aim for changes in individual awareness. Community looked at evidences on strategies used by projects to ensure successful implementation within community groups. And finally, the structural level looked at the strategies that aim to alter conditions on the broader environment, be they legal, political, or cultural, that in turn impact individual behaviors. So for example, on the right side of the slide, you can see an example from a project in Tanzania, where a project that worked, that had the goal of moving girls and women away from female genital mutilation. And you can see how the different stakeholders were mapped to every level. You had sort of young girls and women and their family, their individual decision makers at the individual level. You had village communities intervening at the community level, and then you had local administration that worked to institutionalize these local initiatives. Just to note that these are actually only analytical categories that we used to assess these evaluations. In reality, projects work on at least two or sometimes even three of these levels. In the case of the Tanzanian project, it was all three levels, but this is just purely analytical. Next slide. Right, so with the research questions, I'll hand it over to Monica, and she will now begin with the findings.
Thank you, Radhika. So beginning with the findings on effectiveness at the individual level. So given the three different areas that the UNTF works on, first we will look at prevention of violence. So again, as a reminder, the two big questions we tackled: what are the promising strategies to raise awareness, change mindsets? And then from awareness, what are the strategies to improve individual actions? So next slide. So on promising strategies, one key one that emerged was involvement of beneficiaries in development of trainings. Now, trainings actually make up a significant portion of implementation activities of all grantees. And by trainings here, we include things like curriculum development, the materials used, as well as the pedagogical style that may have been used by a grantee. And I'm going to present two contrasting examples, one from Liberia, one from Thailand. In Liberia, faith leaders developed a GBV toolkit, gender-based violence toolkit. They developed this through a participatory approach. In that participatory approach, they included priests and imams. This was a faith leaders project. And what they did was they reframed holy texts to carry more gender equitable messaging. And because of this, this was considered by the beneficiaries as a very significant output of the project. Now contrast this with Thailand, where the evaluator mentions in the report that the training curriculum and the materials did not seek input from the beneficiaries. What happened as a result is that sometimes the material simply did not resonate. And even worse, they ended up stigmatizing the beneficiary group. And these are two quotes that we have pulled from the report. And the first one says, people in the community thought that the training course was not interesting and not important because the participants did not understand the issues of global human rights and advocacy. So the training materials were going a little bit above the head, so to speak, of the beneficiary group. And in another instance, this is another quote that says, I got confused when I saw a male model in the training course. I asked them, the implementing organization, why they brought a male model into this training course. They said that the male models would draw the attention of the participants. I disagreed with that idea. I think the organizers already stigmatized Khatoe that they like men. More importantly, the participants did not pay attention to the training course because they were distracted. The male model spent some time teasing participants. I think it is not worth bringing the model into the training course. It is like trying to satisfy the organizer's needs. So these examples clearly point to the importance of involving beneficiaries in the development of these materials. Next slide, please. Another promising strategy is to use materials that focus on the underlying sociocultural context. And this is obviously important because many of these grantees, if not all of them, have to consider the deep-seated norms and attitudes that underpin whatever it is that they're trying to change. An example from South Africa was on a project that worked with teenagers to show that to change their notions of intimate partnerships. What the evaluators suggested is that the material should focus heavily on gendered socialization. How do girls and boys get socialized in a way that the ideas that they hold within themselves are already gendered to begin with? So if you focus on materials that tell girls and boys about socialization processes, what can happen? Girls can understand that notions of masculinity are formed so that they can challenge better the boys' behaviors. Boys, on the other hand, can understand how girls are socialized, so they can understand why the girls behave in certain ways, for example, being submissive. Next slide. So now, if you're able to change awareness using some of these strategies that I have mentioned, what are some strategies on improving action? Because we know that improving awareness or changing mindsets is not enough. Well, the reports gave us plenty of strategies for how projects have tried to provide alternative pathways. So I'm going to present three examples. In one example, which is from the Tanzania project that Radhika already mentioned, the project goal was to end female genital mutilation. What did the project do? They provided alternative job options for the circumcisers. That's one group of beneficiaries. Another group of beneficiaries are the young girls for whom actually the FGM was a rite of passage. And so the project said, okay, let us have alternative rites of passage. So this is a way of moving people away from a harmful practice to a different way of doing things that provides alternative visions and alternative pathways. Another way is to provide alternative visions for intimate relationships. The goal here was to change adolescent girls' ideas on partnerships so that they will have more gender equitable intimate relationships. So what did the project do? In order to move from awareness to action, they trained the girls to think about and have alternative visions for what these equal partnerships should look like. A third example comes from the alternative messaging from existing scripture. Again, the project's goal was to end violence against women and girls. So what did the project do? They provided clergy with alternative messages while remaining grounded in the holy texts. So this made both priests and imams feel comfortable to talk to congregants against violence against women. Next slide. So now we move to the second area of focus of the UNTF, which is to improve service delivery. And again, we're going to break it up so that we first provide you with promising strategies to raise individual awareness among service providers. And once awareness is raised, we're going to talk about promising strategies to improve action, and improving action both on the supply side, which means how do you improve action of the service providers, and secondly, how do you improve action on the demand side? That is, improve actions amongst beneficiaries so that they can approach, or find pathways to ending violence against themselves. Next slide. So one important strategy in working with service providers to improve their awareness is, first of all, provide specialized training that improves the service provider's job performance. Now, we found this to be especially true for professional groups such as healthcare workers, police, judges, lawyers, etc. An example comes from the Democratic Republic of Congo. This project trained healthcare workers on the nature and scope of medical forensic exams. What happened after they were trained? Many results were found. One was that the healthcare providers were providing more thorough forensic exams on sexual assault survivors. They were maintaining better practices of patient privacy and confidentiality. And the healthcare workers reported more confidence in dealing with child sexual assault cases as a result of the pediatric training that was given by the service provider, by the project, sorry. Next slide. A second promising strategy is to have targeted involvement of service providers. Now, we know that projects include a number of service providers as secondary beneficiaries. What happens sometimes is that the projects are spread too thin, and this dilutes the participation of these secondary beneficiaries. Two contrasting examples from Tanzania and from Cambodia, and both worked with secondary beneficiaries, i.e. the police. In one case, the implementation worked well. In the other case, it did not work so well. And the difference, there may have been other differences, but one key difference was in Tanzania, it was a very targeted involvement. The project created gender desks at the local police stations. In Cambodia, the involvement was diluted. The main setting for the intervention was actually the workplace. And so the critical secondary beneficiaries were the HR managers in the workplace. Police as a secondary beneficiary it became diluted. And so it did not have the same impact and the same effect as did the project in Tanzania. Next slide. Another promising strategy when working with service providers is to carefully vet them. So before you begin the project, consider the challenges that service providers face that are outside the control of the intervention. And it's important to figure out, are the service providers able to take on the intervention's activities? Again, contrasting examples. This is the same intervention in Serbia that worked in two towns. In both cases, the project worked with staff in safe houses to improve services, which were for women who were survivors. In one case, the staff were full-time, they were well organized. In the other case, the staff were temporary workers, they had 12-hour shifts, and they only had one day off. And it wasn't surprising that the project was far more successful in the first town than in the second. So careful vetting really helps. Next slide. Now again, once you have improved awareness, how can you improve action on the part of the service providers? This is on the supply side. The first is that we identified from the reports was to provide material support. We know that lack of resources hamper action, even if awareness, knowledge, and skills increase. So projects tackle this by giving service providers the resources they need. Two examples, one from Tanzania, already mentioned, the gender desks at police stations were provided with computers and CDs that they needed to do their work. In another case from the Democratic Republic of Congo, medical supplies such as rape kits were given to healthcare providers. Next slide. Now, on the demand side, so now we're talking about not the service providers, but the beneficiaries. Projects were successful when they tackled the last mile problem that are faced by violent survivors. And once again, we know that lack of resources can hamper action even if awareness rises and knowledge improves and skills increase. So projects tackle this by removing the resource constraints faced by survivors. An example comes from Colombia, where the projects trained women and girls on laws, rights, and available services for victims of violence. However, the survivors did not have the resources, either the money or the support, to go to the courts to seek justice. So the project also accompanied the violent survivors to courts, thereby removing that last mile barrier. Next slide. Finally, the changes on effectiveness at the individual level, but working to strengthen institutional responses. Again, what were the strategies to improve awareness of those who are in charge of these institutions? And once the awareness is raised, how do you improve the agency of the institutions to respond to violence? Next slide. So one promising strategy is when training focuses on gender issues, but is also policy relevant. So as we all know, decision makers have competing priorities, they have limited budgets. So how do you amplify an issue? So one strategy is provided in the example. In Tanzania, the project first laid the groundwork. They conducted a needs assessment that was context specific, and it had clear links to policy. The results of these needs assessment were included in a training curriculum that was then used to train these policymakers. The content of the training was both new and directly relevant to the issue and to the stakeholders. They were given training on gender-based budgeting. The results were clear to see. By year 3 of the project, the districts made allocations in the annual budget on gender issues. Next slide. Another promising strategy working within large institutions is to identify bottlenecks and work to remove them. Now, we know these are short-term projects, 2 years, 3 years, and we know that they may not be able to bring large-scale institutional change, but it is possible to identify those bottlenecks within the existing institutional structures, and you can work to remove those kinks. Example comes from DRC. Improper record keeping and poor documentation in the medical and legal system was a serious stumbling block in the ability of survivors to access justice. What did the project do? They worked to improve the medical and forensic record keeping. So this is a very targeted approach to help institutions sort of right themselves in order to then help survivors. Next slide. Now moving on to effectiveness at the community level. Next slide. And the question that we worked with here are, what are some of the strategies identified on how to work more effectively with communities? Next slide. First strategy is early buy-in of important community stakeholders. Examples from Nigeria and South Africa. In Nigeria, the project conducted pre-implementation advocacy to build consensus with staff on a school-based project. The project was taken up with great enthusiasm by the school staff. In South Africa as well, it was a school-based project, but there was no buy-in from the staff. As a result, the staff that were recruited for the project complained that they had to hustle to recruit students to the project. So early buy-in makes it smoother to implement the project later on. Next slide, please. We also identified from the reports that participation of beneficiaries in project decisions are also important, and implementers should consult with the beneficiary populations on important project decisions. Example, contrasting ones from Afghanistan and Tajikistan. Both projects actually worked with Afghan women. In the case of Afghanistan, they were internally displaced. In the case of Tajikistan, they were refugees. The implementers in Afghanistan successfully recruited the Afghan IDP women as community outreach workers. But the implementer in Tajikistan decided, without consulting the beneficiaries, that women who were Afghani refugees would not be able to participate in activities as community outreach workers, and they were not recruited. And the evaluator concludes that this is something that the implementer could have looked at, which is consult with the beneficiary population, it leaves you wondering if it was successful in one context with the same type of women, why was it perhaps not successful in the other context? Next slide. A second strategy is the creation of networks and spaces to mobilize communities. Several projects use safe spaces that allowed the formation of friendships, mutual support groups, where information just flows naturally. This is especially useful in highly patriarchal societies where women's movement is restricted, and not least for hidden populations like female sex workers. Two examples, one from Jordan, where the project conducted classes for refugee women and girls on GBV in classroom settings. These networks allowed women to increase their ability to cope with everyday challenges within the home. So they were better able to deal with instances of violence and also friction with their children. And they repeatedly, the women brought up the Arabic word for powerful to describe how empowered they felt, because they had the space to engage, to speak with, and to go towards different space than their homes every single day. Contrasting that with South Africa, where the project worked with soccer coaches to use sport as a way of engaging with young girls about GBV issues. The coaches mentioned that they had no space where they could meet and discuss their different experiences and strategies. So this highlights the importance of networks and spaces for all project participants, not just primary beneficiaries. Next slide, please. Another is psychosocial counseling for communities affected by violence. This was a strategy used by several different projects, and consistently across projects, beneficiaries found this to be useful, which shows that improving mental health is a real vital community good. And some examples, a school-based counseling mechanism in Vietnam to stop bullying. 3 out of 4 students who received counseling expressed satisfaction with the service. The city's Department of Education has expressed interest in scaling this school-based counseling program. And psychosocial counseling proved to be a critical source of support for refugee women in Tajikistan and Jordan. And offering psychosocial counseling to victims of violence was a key achievement of a project in Serbia. In FGD with the survivor women, the women reported that the project responded to their needs very well by providing psychosocial counselors. And the evaluators, they strongly recommend that these services should be continued in the project areas. Next slide. Finally, effectiveness at the structural level. And the question that we worked with here are the promising strategies on how to work more effectively at the structural level. Simple question. One is to create guidelines and policies. So these try to bring together broader change within the legal, social, and political environment. A couple of examples, one from Malawi. It found that female judges are more sympathetic to GBV survivors compared to male judges. The project created guidelines so that cases can be applied uniformly, regardless of the gender of the justices. In Cambodia, the project drafted guidelines for commune leaders that was effective. And in Ecuador, the project created guidelines on how justice can be accessed, and it included a map of services, institutional actors, and the identification of coordination problems. Next slide. Coordination with ministries was found to be another effective strategies, which ensures that government officials have a stake in the project. The school-based program in Vietnam, they worked very closely with the Department of Education and Training throughout from the beginning. And now the department is ready to scale up some project activities in other schools because they're really part of the whole process from the very start. Next slide. Setting up specialized centers was proved to be another promising strategy because this is bringing new services into a community. And the change really is at a structural level. From having nothing, you now have a new system. That's why we put it under a structural change. In Serbia, the Center for Victims of Sexual Violence was set up within healthcare settings. Women not only received services from healthcare providers who had been trained in and sensitized to issues of GBV, they also received psychosocial counseling. And the new services, especially the counseling, as mentioned earlier, brought much needed services to violence survivors. Next slide. Finally, I want to show some examples of challenges that the projects faced and how they tried to find solutions to these challenges. The first is that the projects conducted one-off trainings and campaigns. And we know that oftentimes one-off trainings and campaigns, they happen, they may be successful, but it's only in the short run. So some projects, they found a solution by identifying sustainable pathways, by using a training of trainers model, institutionalizing a training model, and working with pre-existing networks so that the results can then be dispersed through the networks rather than end at the end of a training session. Another challenge is, as we mentioned, awareness might go up, but the project does not work to increase the ability of individuals to take action. So the solution is that one size does not fit all. Some projects really anticipated for subgroup variation, devised different modalities for different subpopulation, different messages, curricula, training methods, and so on. Another challenge is persistence of unequal gender norms. Some norms change, but some really are sticky and do not. And again, some projects decided that not one size fits all, so they differentiated between different beneficiary groups, try to understand the deeply ingrained beliefs, and devise messages that tackle the issue head on, so that it would resonate with the participants in a culturally sensitive manner. Another risk is that the harmful practices go underground. But the solution that some devised was to learn to anticipate these challenges. Misalignment of values is another one, where the project's values may or may not resonate with the values of the beneficiaries. Radhika will also talk about this towards the end. And the solution is to find partners who have with aligned values. And finally, community leaders may be effective trainers, but they may not be good administrators. So again, to identify the problem early on is one of the solutions that the project devised. Next slide. I'm going to hand over to Radhika.
Thanks, Monica. So just as a reminder, when we looked for the evidence on impacts, we looked at both the intended and unintended impacts. So let's take them one by one. Next slide. With intended impacts, I think we identified three categories. And so let's go through them one by one. The first one is an increase in self-identity amongst survivors of violence. The second is an increase in self-efficacy among survivors of violence. And the third was a reduction in violence. So let's go with the first one, which is an increase in self-identity. Now, this points to the recognition of one's potential and qualities as an individual, especially in relation to their social context. So you essentially are able to accept who you are. And we have two examples, two quotes from different reports. One woman at age 20 says, "I learned how to live freely, more confidently, and free of stigmatization." And a second one said, "The project helped me become conscious of the stereotypes and discrimination that exist about Indigenous women." So essentially, these women sort of really recognize their qualities as an individual. The second category, which is self-efficacy, points to a confidence in the individual's ability to exert control over their motivation, their behavior, and their social environment. So for example, beneficiaries learning how to wrest control from one's abusive partners and taking charge of their own actions, or having an enhanced sense of control and well-being for themselves. And we have two examples here. I think the first one is from a project in from a country in South America, where a facilitator speaks of how their life changed through this project and they realized their capabilities. Or the second example, which comes from a participant in Serbia, who notes that when they got divorced, although they were dependent on alimony, they were able to better control their sense of self and self-betterment. So she says, "Now I'm in the phase where the same alimony does not mean much to me and he can't blackmail me." So you can see there's an increase in self-efficacy. Finally, the third intended impact was a reduction in violence. Now, just to note that fewer reports carried evidence on this form of violence reduction. We had, I think, out of 30 reports, 53% of these reports carried evidence of violence reduction, and the data that they provided as evidence was both direct and indirect, such as for example, a decrease in self-reported incidents between the baseline and the end line, or they used administrative data, which is sort of police records that document violence. In some cases, we found projects made the case that improved awareness or knowledge was the first step towards eventual violence reduction. So this is an example of an indirect evidence, or also the increase in self-reported incidents, which may actually be a positive sign, a sign of greater understanding of what constitutes violence, and a feeling of less fear amongst beneficiaries to report. Next slide. Coming to the unintended impacts, there were a number of unintended impacts, and we've grouped them into positive and negative impacts. And the unintended positive impacts were in the range such as greater visibility of grantees as technical experts on GBV. So they were selected and chosen as technical experts within their ecosystem, which is a very positive impact. Greater visibility also for beneficiaries in decision-making spaces, concerning gender-based violence. Greater trust and increased use of national laws in this area. Greater coordination between government institutions to support violence survivors. Other more specific positive impacts such as the reduction in child marriage. And improved trust and solidarity between different stakeholders. I think in one project, this is a Liberian project where you had improved trust and solidarity between priests and imams, or as an example, women who are violence survivors, and between trust between women who are violence survivors and those who have never experienced violence. So these kind of cross-stakeholder group trust and solidarity. Coming to the unintended negative impacts, we identified 3 unintended negative impacts. And one came from a project from Turkey that worked with fathers. And here, for example, they used certification, which had, as a consequence, the certification was seen by some fathers as an endpoint or an achievement of gender sensitivity and gender inequality, rather than a continuous process of engagement. And in some cases, beneficiaries misuse these certificates as proof of their model parent status, and used it in some cases against their spouses. We also saw an increase in insecurity amongst communities. So for an example, from Bangladesh, in a project that worked with school children, you had instances where boys reported feeling more insecure as girls, their peers around them, gained confidence. And finally, with the use of metrics, in some cases, reporting can be artificially low when villages, for example, or whatever unit, are incentivized to have lower incidences of domestic violence. So they are incentivized to maybe report less, as happened in a project in Cambodia. So that's one example of an unintended negative impact. Next slide. So I think here we come to the research question on sustainability, which is essentially how are these projects sustainable beyond the life cycle of the grant. Next slide. So we looked at 3 categories here: the financial sustainability of project results, the sustainability of results through institutional mechanisms, and the sustainability of project results through intangible means. So if we take them one by one, the first category is financial sustainability, which is were projects able to secure funding beyond the scope of the UN Trust Fund grant and beyond, beyond the scope of the timeline as well. There were only 2 cases where projects were able to do this, from Turkey and Liberia, and these projects were built on intervention networks, and these networks were able to leverage and secure new funding sources. And this continued financial support allowed activities to be sustained and scaled up. Other projects devised ways of overcoming their limitations. For example, not able to secure funding, but through institutionalizing them. So for example, creating training modules that could be embedded within existing curricula, as in a case from Armenia, where a training module from the project is now part of curricula of both the police academy and social work students. Another example comes from Malawi, which used a training of trainers method, which could be replicated and then sustain the project results amongst new beneficiaries. Other projects, as Monica sort of explained through the findings, produce policy documents and manuals that could then be used by institutions beyond the timeline of the project. And then, of course, the last example is the development of a successful prototype, which we saw in Serbia, where a center for victims of sexual violence was created. So it's really the proof of concept was established. Finally, to the intangible ways in which projects become sustainable, because that's important as well. that happens when communities feel ownership of the project approaches or results, as we saw with the gender-based violence toolkit for faith leaders in Liberia, where the faith leaders co-created it, participated in it, and they really felt that they had an ownership over it. Other beneficiaries from other projects said they were empowered by trainings. And an example from Liberia, which says that participants expressed that the project results would live in them forever because their mindsets had been changed. And that, you know, they had sort of internalized some change. Next slide. Okay, I'll hand it over to Monica to begin with the conclusions and recommendations now.
Thank you, Radhika. So some conclusions, recommendations. So the first conclusion from all these findings broadly is that UN Trust Fund projects, now regardless of the form of violence they address or their setting, they effectively promote positive attitudes and beliefs. We found this across the board. They raise awareness on ending violence against women and girls at the individual level, and then they translate these lessons into how to move from awareness to action. So broadly, what can we say for projects? What design elements are likely to be effective? Building context awareness into project design, involving women, girls, communities to co-create the training materials, and moving beyond just the training materials. We're using the word training very broadly. Providing needs-oriented and tailored trainings to service providers. This is another important way that projects can move from changing mindsets to creating more action-oriented goals, involving stakeholders in an intentional and targeted manner, and to proactively identify those last mile barriers to action. These could be material, these could be normative, and then to work to reducing those. The design elements to avoid any one-off and standalone training sessions that don't have any future, because we know that staff changes, in government departments, there is a lot of turnover. So the one-off trainings has to be found a way to make it more sustainable. And homogenized scripts also do not work. You have different populations, even within your one beneficiary population. Identifying the subpopulations is very important. The recommendation that goes along with the conclusion is to trainings and awareness sessions that promote gender equitable attitudes at the individual level are the cornerstone of this type of programming. But in order to be effective in bringing change, they must be designed or adapted from the ground up with clear calls to action and behavior change. This is again reiterating what I just said. Involve project beneficiaries, move from just action-oriented to, from awareness-oriented to action-oriented goals, have long-term strategy for continuous engagement, consider upfront the risks of intervention activities, and draw up some risk mitigation strategies. Use messages that are locally specific to which participants can immediately relate. Very important, document what works and what does not work so that this can be included in the project monitoring and evaluation, and account for those last mile barriers. Next slide. And following from the first conclusion and recommendation, some implications for the UN Trust Fund, which can be applied more broadly to various donors, which is to review risk sections of proposals, including more guidance on these risk management strategies, provide examples of action-oriented results, encourage projects to document these frontline adaptations and messaging, and advocate for contingency budgets so that these last mile barriers can be addressed, especially with projects with marginalized groups. Next slide, please. A second conclusion is that projects have adopted various effective strategies to shift harmful social norms, but some deep-seated norms remain hard to shift, especially within short time frames of 2 to 3 years. The projects that have tried to shift the sticky norms have tried to do this through community mobilization and activism approaches, establishment of new positive norms, providing alternative visions and pathways for relationships. And there are some risks of working on sticky norms that projects should be aware of upfront, which is that these messages may not resonate with the community, that community members may not want to incur the negative sanctions involved in transgression of the norms, or that practices may go underground rather than eradicating it. And another challenge is that there may be a dissonance of values and messaging between the frontline workers and the communities. So the recommendation that follows from these conclusions, next slide, please, is that social norm change is essential, but we must account for significant time and skills and intensive community engagement if we are going to really change social norms. So what can projects do? One, we suggest that there should be a short literature review of norm change, especially as part of project startup, ensure alignment of norms and values between frontline workers and the communities that they're working with, to gradually unpack harmful social norms, because it will not happen overnight, and identify those opportunities and barriers to action as a first step. Working with participants of how men and women are conditioned from a young age to accept a belief system that perpetuates gender inequities throughout the life cycle, and promoting those positive norms, alternative visions, and pathways that we've already mentioned. And finally, this is a repeat of the previous, but it bears repeating, is to consider upfront the inadvertent risks of social norm change. Next slide. And the implications for the UN Trust Fund and other donors is to consider providing funding for longer projects, because sticky norms are sticky for a reason. So they need time to be made unsticky, I suppose. And review the policy on no-cost extensions for projects so that they can be more flexible when it is justified, of course. Err on the side of what seems manageable for the size and the experience of CSOs, rather than being very aspirational. And then another way is to create links with tried and tested norm change interventions or networks, because these are issues that obviously organizations and donors have been dealing with for many, many, many years. I mean, this is the 24th year of the UNTF. So we can draw upon the learnings that have come before and have resulted in these communities, such as the Community for Understanding Scale Up. Next slide. A third conclusion is that anticipating barriers to change throughout the life cycle has been found to be effective. So how do you move the needle from awareness to action? Projects have been able to do this first by seeking early buy-in with community stakeholders, especially when they had a pre-implementation advocacy plan. When they have gone beyond just consultations to involving secondary and primary beneficiaries in important project decisions, by creating and tapping into networks, safe spaces, so that dissemination can actually happen very naturally. This is especially true when gatherings are either difficult or they are forbidden. And not to treat the community or a specific group as a monolith. You may be working with youth or men and boys or female sex workers or lesbian women, but within those groups, there are subgroup variations that must be understood. Those may happen because it's a geographic thing. Some women live closer, some women live further. It may be an identity issue, different types of identities amongst indigenous groups. Understanding subgroup variation is very key. Next slide. A recommendation that comes from this is that awareness raising at the community level should have clear calls for action, and they should work on reducing barriers to it both before, during, and after project implementation. Like we mentioned, all of these things: subgroup variation, pre-implementation advocacy, creation of networks, considering upfront the inadvertent risks, so like having a risk management strategies, and identifying early on the champions who can anchor the intervention even after project funding ends. Next slide. Implications for donors. Again, taking care to remind grantees to consider the various subgroups, ensuring guidance of risk management strategies so that you can anticipate what might be barriers to action, providing examples in the guidance given to grantees on promising strategies that projects have used so they may learn from one another, and drawing up guidance on exit strategies so you can already anticipate and plan activities with an eye for how the results may be sustained. Next slide. A fourth conclusion is on service providers specifically. We know that UN Trust Fund projects have been very effective in working with providers to improve service delivery and strengthen institutional responses. But these are especially successful when engagement with service providers and policymakers are well-planned, focused, and meaningful. And projects have been able to do this when they have carefully considered the number of secondary beneficiaries to include, given that there are always time and resource constraints. Carefully vetting the service providers so that you make sure that they have the capacity to uptake activities. And when the trainings and other activities have been made practical and meaningful to the service providers and policymakers. And quick examples of how projects have done this: they have tried to improve the skills and job competencies of providers, removed institutional bottlenecks, provided material resources to service providers, created useful policies and guidelines, and last but not least, had a specific ask for policymakers, knowing that their time and budgets and etc. are limited. Next slide. Quick recommendation from that for what projects can do: vet the service providers, carefully consider how many to include, link the activities to clearly define goals, have action-oriented goals, value improvements in the mental health of survivors, invest in trained psychosocial counseling, and again, so this idea of confronting risks upfront comes up very frequently, so it's mentioned again here. And finally, the next slide is on the implications for UN Trust Fund based on this, to have guidance to make sure that the projects are multi-sectoral and holistic, but it's not overambitious. Review the guidance so that beneficiaries are selected properly and projects are not spreading themselves too thin. Vet the capacity of the grantees and provide examples of these, again, to have action-oriented goals, and to include professional psychosocial counseling where referrals are not possible. Next slide, please. The next conclusion is on impacts and measuring impacts. We found that almost half of the projects have measured impacts and have observed reduction in men's perpetration of or women's experiences of violence, but each evaluation is measured it differently. And this points to the challenges of measuring violence against women and girls within very short time frames. So evaluators conclude that it is appropriate to measure the precursors of ending violence, given the short timelines. It's unrealistic to expect that there will be large shifts in violence reduction in the short time. And these points were already highlighted by Radhika in the impact section of the results. So we can move on to the next one for the recommendations that come from this. So what projects can do is to have continuous M&E plans alongside the rollout of the intervention so that you're able to track what is happening as it is happening, co-creating measures with the project evaluators. So you have these evaluators early on, they can be part of your theory of change, include measures for both individual and social change. And you can separately capture changes in self-esteem, self-identity, self-efficacy or agency, but also collective identity, collective efficacy, and collective action. Ensure that unintended consequences are part of periodic project monitoring, and so that it allows for mid-course correction and project monitoring. Next slide. The implications for the UN Trust Fund here are that you review the guidance on M&E plans, so these tips can be taken into account. Very important is to hire evaluators at earlier stages in the project cycle to design appropriate collection measures. Another important thing is to consider setting aside an impact evaluation budget so that the projects can be evaluated 6 to 12 months after it ends, so that you can see whether results have been sustained. And for future project analysis, include reports and other project data, not just evaluations. Other things to do in the future is to involve grantees and learning and co-creation of conclusions and recommendations. We found that to be very helpful. To consolidate case studies and examples of what does and does not work by theme. Next slide, please. I'm going to actually hand this over to Radhika.
Thanks, Monica. A sixth conclusion that came from this exercise was that UN Trust Fund projects that anticipate the challenges that women may face in asserting their independence and find ways to mitigate these have been effective in reducing violence. What this means is that UN Trust Fund projects do recognize that equipping women to address the violence in their lives takes time. And many of these projects, as Monica pointed out, they have short cycles, 2 to 3 years. And Project evaluations also highlighted the need to be aware of the possible burden women may feel as quote unquote agents of change, because they bear the responsibility of taking action within their communities. And so a number of promising strategies helped alleviate this burden, such as providing support networks outside their families, because we found that across projects, women responded positively to interventions that created informal, safe spaces for friendships and mutual support groups amongst women, building on the principle sort of that we have strength in numbers, and that the collective can provide support when the individual burden of bearing change proves to be heavy. A second way is to offer alternate pathways to developing their independence, away from their abusive relationships. And here this could be, strategies that range from establishing shelters for them to leave their homes, and live independently, to empowering them economically so they are financially independent. And finally, creating an enabling environment for women to assert themselves as well is important. There was as I sort of pointed out earlier in the impact section, a feeling of insecurity amongst men and boys, and projects that anticipated this challenge had included them as allies to the intervention, allies in bringing about social change, were able to prevent their efforts from being viewed as a zero-sum game between men and women, where women come out as winners on top. Next slide. So the recommendation, there are two recommendations here. The first one is, while investing in strategies to help women become change makers, projects should consider mechanisms and strategies for sustained support to alleviate their burden. And I think I've mentioned some of these. So one thing that projects can do is anticipate the burden that they can change. You can build informal networks. You can also value the contribution of women in public. We found that in instances where the knowledge and experiences of women activists were recognized, actually increase their legitimacy and their ability to work. Of course, also consider the economic empowerment of women and involve men and boys as allies. Next slide. This is a recommendation specific to the economic empowerment strategies. That is to say that they must ensure that women are able to sustain their activities beyond the life cycle of their intervention. We found that projects can actually select women carefully for economic empowerment programs by mapping and weighing their individual interests, their ambitions, against the constraints that are often enforced at project startup. Things like ensuring the selection process is transparent and available to everyone involved at the project, including a hands-on training component that covers basic skills required to run a business. So not just focusing on theoretical sort of business and economic education, but giving them hands-on skills, like teaching them bookkeeping and accounting and supply chain management, and over and beyond. I think the point here is to equip them with the skills they need, and then of course planning for a continued, if slightly different, engagement beyond the training. I think it could be, for example, light touch hand holding or an incubation of their business. So think of this as really as business development. So you have training and then you sort of have a hand holding process, and these can be very beneficial in helping women sustain their businesses over time. Next slide. So the implications for the UN Trust Fund is encourage projects to include men and boys as allies early on in project activities, encourage projects with economic empowerment goals as they help women become independent, and encourage projects with economic empowerment components to actually have a more hands-on practical sort of section to it, sort of teaching them how to run a business and not just giving them economic education. Next slide. The seventh conclusion we found is that while project cycles may be limited and finding channels for financial sustainability may be difficult, projects can still find pathways to continue their work even after UN Trust Fund support ends. And this connects back to the evidence that we found on sustainability, because one of the primary challenges for UN Trust Fund grantees is the sustainability of their work. And it's quite a tall order because many of these projects are ambitious, they're high intensity, many activities, and it is a tall order to expect the complicated managing of these projects, but also seeking active funding at the same time, given the short time frames. Yet we do see, the evidence shows that only 2 out of 30 projects are financially sustainable at the time of the end of project evaluation. That is to say, followed a more linear pathway for sustainability, which is that you secure more funding to ensure scale up. But we did find that projects have been affected in sustaining results by institutionalizing the key concepts of ending violence against women and girls. So not necessarily only following the linear pathway, but thinking along other lines. And we saw this in sustainability. I'll sort of just skip through them quite quickly. Institutionalizing concepts, embedding project created materials, creating manuals, investing in new institutional systems, such as the creation of the new Center on Sexual Violence. And then, of course, the intangible ways of achieving sustainability. Project beneficiaries, where projects include project beneficiaries right from the beginning, there is more ownership of the project and kind of what the lessons of the project. The importance here is the importance of participatory involvement in project decisions, because that really is the mechanism through which ownership is inculcated. Next slide. So what can projects do? I mean, we've said this through in many different ways through this presentation, but CSOs should look at different forms of sustainability by institutionalizing project results, investing in networks as well. I mean, you may not have the financial support to continue, but investing in building networks with other CSOs in the ecosystem, building ecosystems as well. These are all good ways of thinking of sustainability out of the box. Next slide. So finally, what are the implications for the UN Trust Fund and other similar donors? One would be to fund CSOs for longer projects of at least 4 years, because this is the recognition of the time needed to sustain project results and to account for startup activities and pre-implementation advocacy. As Monica pointed out, set aside an impact evaluation budget and evaluate the project 6 to 12 months after it ends, because we often don't see the results immediately at the end of the life cycle of the project. Evaluating 6 to 12 months after helps properly evaluate the sustainability and impact of these projects. Encouraging projects to develop an exit strategy at the beginning itself is an implication that can help, because it can result, so that results can be sustained through institutional mechanisms. You're thinking from the beginning of your exit strategy. You can also provide examples of institutional sustainability and guidance for grantees, so give them examples, and also include the participatory involvement. This is something we've mentioned before. And of course, continue with the by invitation only window. Next slide. Oh, thank you. I'll hand back to Monica to wrap up.
I think we hand back to Gemma, I think, at this point.
Wonderful. Thank you so much. That was so rich. I've read this many times myself, but still every time I look at it again, I'm learning something else and thinking about how I can apply it in our work. So a huge thank you to Monica and Radhika. In just a time, we're going to move straight to questions. So I'll leave this slide here for you to read yourselves as we turn to questions. We obviously will be doing a lot with these lessons, not least to inform our next strategic plan and our own grant making strategies. We will be publishing the full report by the end of the week. We will email it to you all and put it on the website. We will share the PowerPoint, the recording, and we are currently translating the full report into Spanish and French. So we will do follow-up sessions. So, but now I will move to Shruti, who's been managing the questions.
Great, thanks Gemma, and thanks Monica and Radhika. So we've received a lot of really exciting questions. I think they can be broadly grouped under questions about the methodology of the report, a little more interest in the outcomes, particularly violence reduction, sustainability, and if there were some surprises. And then there's some questions that I'll direct towards Gemma, which are about the trust fund and the grants. So I'll start with there's 3 on methodology, so I'll cluster them together and start with that perhaps. So there's a question from Ben. So he says that, I understand that the meta-analysis assumes that treatments, policies, or practices under evaluation have a common aim. However, violence against women has been conceptualized differently by different groups, which also means that if the problem is defined differently, the goals are different. So how did we deal with this sort of massive variation within our sample? A second question on methodology comes from Selena. Thanks, Selena. Great question. So she asks, were there certain areas where collaboration, partnerships, or working together cross-organizationally was seen to be critical for success and impact? This can be understandably hard to measure through the lens of one program alone. So if there's any suggestions on sort of how do you read across, how do you read through partnerships? And there's one from Aran, which I saw, Gemma, that you just answered, but it's basically about did the duration, or the modality of funding really, was that something that we looked at, and did that influence the outcome? Are they likely to be more successful based on the duration of the program? So I'll stop here and over to you guys.
So I suppose I can start. The first one is a really important question. It's true. And I think I pointed it out at the beginning that one of the key things was figuring out how to wrap our arms around this very diverse set of projects, which, yes, they had different goals, they had different aspects that they were trying to tackle. Some were trying to do laws, some were trying to stop harmful practices. So how do you, I think that's the upshot of the question, right? So you have these different, so how do you, so that's where, yeah, we did struggle. I'll be honest. It's not an easy thing because how do you, so essentially how do you compare, are you comparing apples with oranges? So one cut of the data was to say, all right, they are still grouped under prevention and improving service delivery and national laws and so on. So the UNTF already has these 3 buckets. So we tried to work within those. We also, so when we created essentially an Excel sheet for every project, and we had a similar set of codes that fell for every project. Now, of course, if a project did not work on laws, it didn't get coded under that. So in that sense, we were not comparing apples and oranges. And so the coding took care of some of those issues. Also, the ecological model we tried, like we said, these are analytical categories. So the same report may have been coded for all 3, for structural and community and individual, depending on their goals. So again, we would only compare those that would fall under any one of these buckets. It wasn't perfect, but it's really sort of the best we could do under very complex circumstances. But data is messy, and part of the whole challenge is to make it less messy so that you can draw some useful conclusions that can be very useful for practitioners. That was the goal. That was our goal. The second question on collaboration and partnerships, I would say that one of the sort of the limitations that we had in this data set is we were only looking at the evaluation reports. Sometimes it wasn't easy to figure out how many partners were involved in doing the implementation. Oftentimes we would read, that the grantee was one group, but actually in the report that different, entities were mentioned. So presumably, yes. I mean, even the faith leaders group, it's a pretty broad network. So these are, and the grantee may be collaborating with local NGOs that are doing the work in the districts and the provinces and so on. So absolutely, I think there are good examples of collaborations and partnerships that work. But it was a little bit difficult to know exactly what, given the lack of description in the report. So using other data would be very, very useful, including project data and so on. I think those were the questions, unless Radhika has something to add. So the third one was for Gemma, right?
Can you repeat that one again?
Sure. It was a question about whether we looked at the duration of the project and whether that had an impact.
This study didn't specifically look at that, but our project is an interesting question. Our projects typically last for 3 years, but I think there were at least 2 in this sample, which actually were successful in receiving an additional grant from the trust fund, because we do have a special window called invitation only window for grantees that show promise for scale up and results. So it didn't look at that, but we do want to do a follow-up study specifically on those projects that we've been able to fund for 6 years, because there is pretty clear evidence that projects specifically on social and behavioral change take much longer than the typical 3 years. Thank you.
Great, thanks, Gemma. Then there's some questions, I would say maybe 3 questions around the outcomes. So there's one on, were there any surprises? Are there conclusions and lessons that really surprised you and challenged conventional wisdom? And then there's a question also about sustainability that I think is very interesting. I think I lost it. I think it was about, from Angelica, with regards to sustainability and scalability, do we know what percentage of these projects actually scaled up or were expanded by governments, whether at the local, provincial, or national level? And there's a question about violence reduction. So do you think a reduction in violence is a positive indicator? Sometimes the impact is an increase in reporting because of the intervention made, and women and girls are less reluctant to report cases of violence and are ready to break the silence. So is that positive? Is that negative? So yeah, 3 questions, one on what were the surprises, one on sustainability, perhaps that one's for Gemma, and then one on violence reduction.
So just about the violence reduction, because it's the last one that came up. Absolutely. I think we found that evaluators were saying consistently that when girls and women report more, that may be a positive sign, right? That they do not fear reporting it compared to earlier where they were experiencing it but were not reporting it. And this points to an issue that has come up, that measuring violence reduction needs more time. So we need to, if these were longer term projects and if they were evaluated a little bit after the end of the project, would be very useful. And thirdly, to have indicators from the very beginning. So if projects, it's a tall order sometimes because there isn't budget and all, but if evaluators can be part of the early project discussion on indicators to measure or indicators of processes of change, doing both qualitatively and quantitatively, I think we will learn much more about violence reduction and which direction and which pathway this goes. In terms of surprises, I really like that question. So some of those came up in the unintended impacts, especially maybe the negative unintended impacts were surprising. I think what is more, so for me that, and Radhika can mention if there were others that were surprising. I think that the thing that we were trying to do here is have findings from practitioners, from the ground, so to speak, that resonate with people on the ground, because this is hopefully going to influence and impact how donors approach these types of projects and how we evaluate them and monitor, and it should pass the smell test, so to speak. It should resonate first and foremost, that yes, everybody sees this regardless of context and country and project and so on. So I didn't want too many surprises. I wanted it really to be useful for the people who, for example, are participating in today's call. The sustainability question for Gemma.
Is it mainly on financial sustainability?
I think sustainability in terms of uptake with local governments, at different levels,
we definitely have some evidence that our projects, the projects we fund, are scaled up from local to national level. What we want to do is do a study to actually document that. I mean, many of our projects were the forerunners of big initiatives like the Safe Cities project, or we've funded in the past Raising Voices to implement SASA, which has been adapted and scaled up. In this in this sample, Physicians for Human Rights was implementing their Medicapt Act, which was scaled up in another country. So we have a lot of evidence we now need to bring together. And we see that projects are taken up both by government, but also other UN agencies, and also in the case, for example, of SASA, are adapted by other NGOs, and they're accompanied by training. So that's all thanks to Raising Voices. So we would love to do a little bit more digging into this. And we particularly now can do case studies by country. We have funded a considerable amount of projects in specific countries by chance, like Kenya, Serbia, and Cambodia. So one of the things I was going to say in the end was a plea that anyone who wishes to partner with us to do deeper dives into certain countries or certain themes are very welcome, because we have this vast database and a lot of interesting research questions we want to answer, and that's one of them. On financial sustainability, we always support the civil society organizations we fund at the end of the project with, for example, references if they want to make a bid for additional funds from other donors. We disseminate the findings of their evaluation and promote visibility through our social media. We do what we can to ensure the financial sustainability. And although these evaluations showed that some were not financially stable at the end of the project, we have we do what we call a partner survey. We survey grantees up to a year after their project ends to find out if they've been able to mobilize additional resources. And in the most cases, I think about 60% are able to mobilize additional resources, but we would definitely like to do a lot more on that to make sure these projects are sustainable, where they're showing promise for growth. Thank you. Back over to Shruti.
Great, thanks so much. I want to be mindful of the time. I think we're close to the end of our time. So maybe we stay for 5 more minutes, and then, of course, if anyone has to drop off the call, we'll completely understand.
We'll try and answer more questions in the chat, and then maybe I'll focus the questions from Monica and Radhika, and I'll try and answer a few in
the ones for us in the chat. That's a great idea. So there's questions, Monica and Radhika, about, did you see differences in approaches and impacts by different groups and beneficiary types? So for example, adolescents, women with disabilities, or indigenous women, was there that cut in this report? And then we also have a question from Diana about, do we find any lessons around sharing the evaluation findings with national and international stakeholders when, through the evaluations? And then we have a question from Manuel that did you see any projects that showed reduction of work that used a rigorous impact evaluation? And then last one, if I can cluster it together, is from Leah. It's about a very important topic, which is, were there any findings on mental health and self-care of service providers and or grantee organizations? So over to you.
The question on the different cuts in the evaluation reports, I honestly wish there was more. I'll be upfront in saying this. I would really encourage evaluators to consider beneficiary groups not as a monolith, but the different subpopulations. And that's one of the conclusions as well, is to encourage more, but because sometimes the evaluation reports read the same. Everybody had a good impact or a bad, not so good. Sometimes there is that kind of attention to detail, but you sometimes have to read between the weeds to get to that. It's not upfront. It's not a question that is posed at the very beginning in terms of subgroup variation. So I really encourage all of us, including me, to consider that more, and that will provide much more richer evidence. Sometimes there was, I don't want to say that it was never the case, but it really was sometimes finding a needle in a haystack kind of thing. In terms of impact evaluation, I believe So that's a tricky question to the extent that sometimes there was mislabeling, quite honestly, of what is, to me, does not read like an impact evaluation, but is written up as such, mainly because the standards of what is a good impact evaluation have become more and more rigorous over the years. So in terms of how you bring in what is a control group is an important one. And it's not to say that the projects did not do it well. I'm not saying that. It just was not written up necessarily as a careful consideration of which is the treatment group and which is the control group. So there was some of that. But I think overall, I would say the projects did make an effort to work with whatever data they had available. So from the evaluator's perspective, not all projects were collecting data from the get-go. So sometimes there wasn't baseline data to work with. So how do you then, measure between? But sometimes they did as well. So the impact evaluation, the Vietnam project, I think, was meant to be one that was going to have, did have control groups with the treatment groups. But I would have to read more, look at the data more to be able to say, yes, this was an IE. The question on mental health, is it for the beneficiaries or is it about mental health? I mean, is it about
organizations?
Sorry?
For the organizations, was there anything on self-care of practitioners and such?
That's a great point. And I can't say off the top of my head that I read anything like that. No. So yeah, I mean, it's a great question. That was a surprise. There was one about sharing the results with organizations. I think a lot of projects try to do that. I think it's also required by the UNTF to have a consultation with stakeholders. So I think many did. Yeah. Am I missing out on any question?
No, I think we've got everything, and Gemma's answered most of it.
Danielle offered to answer a question on self-care. There was a question from Leah.
Yes.
Did you cover that already?
Danielle, do you want to go ahead?
Mm-hmm.
Oh, sorry. I think I probably was just clicking buttons here, but I'm happy to address on self-care. And I know that probably why it didn't come up in these set of evaluations in this particular sample is because we started introducing self-care budgets for small women-led organizations just a couple years ago. And we're actually really excited to be able to kind of pull together some of the information we have around budgeting for EVAW programming and budgeting that specifically includes self-care budgets. So actually watch the space because we're going to be sharing some of the insight from that assessment and analysis in the next, I want to say, several months. So happy to come back to you on the self-care piece, but we do consider it to be important, and we recognize that, across the world, even the idea of self-care, collective care, it takes different forms and definitions, and so we're happy to engage in that conversation further. And I guess while I have the mic, I'm gonna call time. We have come to the end of our webinar. I'm so glad for everyone who was able to join today, who engaged either via the chat, the question and answer box, and also who are, sending their sort of feedback via email after having received notification of this session. We will be sharing the report and the recording very soon. So stay tuned to hear from us at the Trust Fund. I just want to thank Monica and Radhika for this work, this extensive piece of work. which really is a second piece of a bigger project. We did the meta evaluation first, we did the meta analysis, and now we have a lot more to come in terms of synthesizing our body of knowledge and elevating practice-based knowledge that is really the work of the civil society organizations that we engage with through the trust fund. So I would say that's it from me. I don't know if Gemma would like to say any other closing remarks, but thank you again.
I think you've covered it, and we look forward to seeing you all at future presentations. Thank you very much. Thank you to Monica and Radhika, and to all the civil society organizations that we fund for their important lessons. Thank you.
Thank you, everybody.
Thank you.